purpose. So thank you for the presenters. So I was interested to hear role of government in governance of health. So I was, as you know, the government is not one entity. There are many ministries: Ministry of Finance, Ministry of Labor, Social Welfare, Health. So, and I was impressed to know about the Thai health structure, where these different ministries are working together. But in other countries, especially in developing countries, it's very challenging. For example, for health minister to work with Ministry of Finance or Ministry of Labor, Social Welfare. But in Thailand, it seems works very well because of that there is good success in UHC, etc. My question is whether that spirit, the collaborative spirit between these ministries are similar as used in the Thai health, and it applied to other areas like health financing or insurance. What was the main success of working, the different ministries working together as one? So what was the main features, factor for interministerial collaboration?
As chairman of the Finance Committee, as former chairman of the Finance Committee of the NHSO, of bargaining with the Budget Bureau, I think that if you have good data, reliable data, and you make the claim that the government has promised people that they will get free medical service, okay? And if it is subject to some degree of control through the data of what the cost and everything is, and because the NHSO use a capitation system, use the DRG system, which has a control, okay? There is, at the time I was involved, the government was very forthcoming with the supplementary, with increases in budgets every year, okay? I don't know what has happened since. It's largely because the government has changed. Largely I believe that. And they have put a freeze. Now in Thailand, given the rights that people have, the budget cannot be frozen. It has to be, because people age, that costs us about 2% every year on the budget, okay? Then the government itself has increased salaries. Sometimes the Ministry of Public Health itself increased salaries, not quite properly, okay? It's just by some shenanigans, okay? All of this has to be provided for. But I'm trying to come to a point where when I first came up, I'm sorry to sound so undemocratic, but it seems I have a role to play every time there is a junta, which I don't like at all, okay? But somehow I can't get along with most politicians, with half of the politicians in particular, okay? And so anyway, so at that time I established some precedent of having it entirely cost-based, have the ministry, have the Budget Bureau come and look at our cost, okay, see the process. And I said, I'm willing to accept that the cost estimate is wrong or this or that, but I'm not willing to accept, and I've worked as a macroeconomist too, I'm not willing to accept a macroeconomic argument that we have no budget, okay? I know, with the last government, the freeze was put on because the Budget Bureau said that we have no budget. Now, as I said, all these increases involve less than 10 billion baht. 10 billion baht a year, okay? this is in a government where the government, which has, yeah, they dicker about that, but then they decide to give a discount on the first car, tax of a first car, which costs 80 billion baht off the top from the budget. And then they have an off-budget item, which is a couple of 100 billion baht. That doesn't make sense to me. Okay, but I was involved in the bargaining at that time because they don't like me. So I wasn't there. But it's an argument that I'm trying to put forward, that the government must be able to guarantee not the level, but the growth, because of the dynamics, certainly of the aging effect. All right? And if there is a decision to increase pay of personnel, the government must approve. Okay? You must remember that NHSO work largely with public hospitals. Okay? And so if the increase in pay exists, the government must approve. And once it's approved, they must be paid for out of the budget to the NHSO to be given to the. So, I mean, all these things can be done, okay, and can be worked if there is an agreement on a system. In the end, I consider these institutional arrangements. It doesn't mean an organization, right? It's an agreement, a contract, if you will, okay, of sorts, which has precedent and which everybody follows the year after that, and can be changed and modified within that framework. Okay, that's a way I see of handling changes that Dr. Mongkon talked about. There are changes and they have to be provided for. And you have the one thing that cannot be changed is a promise that you have given people. You have to deliver on that promise. Unless you have a rearrangement, I mean, part of the promise is co-pay. No co-pay whatsoever, which is to me quite proper for a country not with a lot of poor people, but certainly with vast differences in income distribution. If you're going to have a co-pay, the same co-pay may seem trivial, like 30 baht co-pay may seem trivial to the large number of people, but for a few poor people, it's a lot of money. Okay, but 30 baht is still very little, and it of course yield very little. But in any case, bottom line is you have to set up institutional arrangements which can change, and most important, coming back to Dr. Paiboon, sorry. Most important, it must be able to adapt. Okay?
Okay,
that's one thing I learned from one political scientist who got a Nobel Prize in economics.
Okay, I think we are pressed with time, so probably if we go over time, it's getting more and more hotter in the discussion, and unless there is a crucial additions, I know there are two questions. You can throw those two questions, and then we'll give participant 1 minute to the panelists to wrap up on that before giving it to the floor. Maybe the questions very short.
Any microphone, please?
Yeah, I think.
Please.
Go ahead, please.
Oh,
Just very brief, please.
oh, thank you. I'm from Maldives, and my observation is oftentimes when politicians change, when governments change, they bring with them their own ideas, and this is something that happens. This has happened like in Maldives also. We experience the decentralization process in the health system, and now we are reverting to some central role in management of the system. So my question really is, what safeguards or anchor points you have within the new Thai health system to ensure that there's no tinkering by the politicians, yeah, and
Yes.
governments. Yeah.
Okay. The second question, let me, yes.
Yes, to the back.
Yeah.
Yes.
Maybe. Yes.
The automatically microphone come to you.
Thank you. So how in governance do you involve the poorest of the poor? Because often they are too busy or due to social reasons, it's very difficult for them to engage. Then the
Yes.
question of the financing of governance beyond what was talked about, the syntaxes.
Okay, I'll ask the panelists if anyone for 1 minute each, if they have comments on this.
I'll respond very quickly on both of them, actually. The second one, I think how to involve the poorest of the poor is a key problem, but one of the ways is via NGOs that can represent them in some way or other. I mean, there are a lot of experience across the world. I mean, in various forms of management. It's not an easy question, but there are various ways to approach it. I think the question from the Maldives about government change, I mean, the question was specifically on Thailand, but I think it's a generic issue. I think there is a risk that the more you organize your overall health system, the more at risk you are of having the whole system disrupted by meddling of politicians. I mean, it's always difficult to say what is meddling and what is legitimate governance. And I think each country must make up its own mind in the light of its own political system, how to draw the line between the meddling and the legitimate engagement. I mean, in the UK, we see constant reforms and changes driven by politicians, and they have the ability to do that because of the centralisation of the NHS. I mean, that's why I think it's important to argue also for the downward accountability, so that you do have some balance between the central influence and the local influence, so that you can help to counteract that. But I think governance goes to a central feature of any health system, that is, it is legitimate for, given your governance system, for there to be political involvement, but then you have to be concerned about where those motivations are coming from. Thank you.
Well, it's about the participation of the poor in the governance. And I can tell a little bit about our own organization, the BRAC, which is an NGO. Of course, we don't have them their full representation in the board of BRAC as such, but there is a bottom-up mechanism through which the poor people's voices are heard, even up to the board level. And then we also have as I said earlier, the ombudsperson, who is very independent. He reports directly to the board of BRAC, and anybody can complain or bring any issue to them. So that there are different ways that we try to listen to the voice of the people, including the periodic satisfaction surveys that we do from time to time in order to understand what our poor participants are feeling about us.
Thank you. May I request?
I would like to say a bit before we finish. Actually, governance, I think the governance still exists in all the world. Most of the time, I work at locality, and I see at local level, the local politics is very important and very crucial. And the most important thing is think out how can we keep governance running all the time. Actually, governance should be the means, not the end. And actually, when I work at the local level, we found that whatever of the modality of the governance we need to combine, actually, they are not mutually exclusive. Even the characteristic of the governance or the good governance, they are not mutually exclusive. So how to combine and to survive is the best thing that we should do. Thank you.
I think with those words of wisdom, I would give the floor to Professor Surichai to sum up the rich ideas. I'm sure there are people would have preferred more discussion, maybe another half day, but.
Humbly, I cannot summarize the very interesting and very exciting issues said. But just to finish here, I will be punished by the moderator. So first, may globalization and governance is not just two, but it is globalization demands governance. Without governance, globalization will go very much more problematic. I think that is we agree. So in that context, we live in a context where the last few issues said is about disruption. We live in a world where we are a world of uncertainties, not only in economic terms, but also in terms of our system of government and governance. So I think how my second point would relate to the meaning. Although the DIY formula was adopted earlier, but now we come to a kind of, we share the concern for coordination of policy, we share the concern for accountability, we share the concern for resource allocation, and also, may I add, I think we share a concern that we did not spell out, but I think this is another element of governance, which is knowledge. Knowledge as governance, data, quality data as governance, and all this, I think, bring us to value this forum itself. Now, apart from looking at the three modalities, but in fact the world is in reality they are mixed. But still we need to look into even more diverse actors and social movements. And people also propose that we look into multi-stakeholders and multi-level. So in that sense, may I add that another point seemed to come to us that governance, although friends proposed we should have a few objectives, good governance, or good enough, or innovative governance. But I think let us stick to the keyword governance, which is a central, which is going beyond the government and going beyond just let the market runs. So there, I think we share that concern, and in that sense, the present context in this room make the learning from Thai experience not Thai-centric, but make the case more global and regional in making comparison. So with those words, I think we are pointed by the debates or discussion that there are inadequacies or lessons to be learned from many points from our friends here. We are warned that we are entering in even an uncertain context, like it or not, like junta or not. We live in a political reality where we have to develop ways of engagement which is grounded. And also, I think the key word here is legitimation or legitimacy. Junta do not have unlimited legitimacy. The real legitimacy should be grounded in the democratic system, where we also have found some difficulties in our own design. So in that sense, may I just finalize this, that the lesson to be learned may be even more important than lesson learned. Lesson to be learned is that we are living in a context where, although we have developed a few quite a few meaningful experiences. But yet, if to the words of our esteemed wisdom, Professor Ammar, he sounded very pessimistic. But at the end, he said, I am optimistic. Suddenly, he becomes optimistic. I mean, I just say this in the language of the intellect and the language of the mind, the language of the heart. It demands some way of governance. Some way of governance, meaning we need friends to, in the context of health governance, as the topic spells, the Health Commission, which is supporting to have this organization, and we are grateful for all the friends who have brought in the frontier of exchange. We need this kind of meaningful exchange and reflections to push further the frontier of our own adaptation and our own learning. We cannot become self-complacent at all. And that's because we are living in a context which is very regionalizing and globalizing. Thailand cannot live without our friends from neighboring countries who work for a lot of us in many ways, both skilled and unskilled, so to say the least. So in that sense, we really need to have a National Health Commission more grounded in a globalizing and regionalizing context of learning. So with that, may I say that we are so grateful for the moderators and also looking forward for furthering new frontiers of research as well as cooperation. Thank you.
Thank you very much. I would like to just announce that, by law, by regulation right now, we cannot talk about politics sitting more than 5 persons. But we are not talking about politics at all. So just to clarify. And then tomorrow there will be a side meeting or side visit also to one location commended by Dr. Mustach. It's a Thai Health Foundation tomorrow, one side meeting of the PMAC. And also the topic that we are talking about today, this morning, is not a side meeting by itself. It is actually one of the topic in the main meeting, the governance, beyond 2015. So we will learn more when we engage in the PMAC activities. But in front of our room, you see that there's a document, a CD, about participatory healthy public policies. And also this folder about governance by network, also very useful. Please, if you don't have it yet, then when you go out, just pick it, and then you can also get benefit from that. With this, I'm sorry that both of us do not doing things well. We cannot control the time. But I think please forgive us, because the topics and the contents are so very interesting, and we would like to learn more. And that at the beginning I said that I didn't know much about governance, and I still know not much. But I learned a lot already, but still not enough. So with this, I'd like to thank all the 6 presenters, or actually the 7th one also sitting in the back, and also my co-chair, my co-moderators for operating this session. And finally, I'd like to thank the National Health Commission Office for hosting this side meeting together with 4 other organizations. So.
I do the same, but I realize that the organizers have some other things to do. Kunnanut, I give back the floor to you, and thank you for all of you.
On behalf of the organizers, we have to thank the honorable speakers and moderators once again. And I believe that everyone feels the same with me, that the side meeting is interesting and knowledgeable, and time flies. No one realized that. And before we are ending the side meeting, may I invite the Deputy Secretary General of the National Health Commission Office, Mrs. Orapansi Sukwatana, to give a token of appreciation to Professor Ammar Siamwalla ค่ะ and Professor Ann Mills Dr. Mushtaq Chowdhury Dr. Phaiboon Suriyawong Phaisan and next to อาจารย์ Dr. Wiwat Rojanapithayakorn Dr. Yonas Tegegn Professor Surichai Wan-kaew and Dr. Vinai Leesmidt And lastly, before leaving, could we have the group photo, all of you, please? And may I invite Dr. Mongkol Nat Songkla, Dr. Suwit Vibun Phon Praseut, Dr. Pong Pisut Jong Udom Suk, Dr. Pairo of Thai Health to join the group photo.